This one small change dropped my blood sugar by almost 50 points. As a physician assistant working in endocrinology and a type 1 diabetic for close to 40 years, I've dedicated countless hours of research and personal experimentation to discover the most effective and straightforward approaches for reducing blood sugar levels. Many of the tips I'll share with you today are extremely simple, taking mere minutes to implement. In fact, one tip I'll share with you at the end literally requires you to do nothing at all, yet it can lead to a remarkable improvement in your blood sugar levels. So that's what we're going to talk about today. 5 extremely effective, often overlooked methods to lower your blood sugar levels. So let's get started with tip number 5. Improve the quality of your sleep. Now you might be thinking to yourself, what does sleep have to do with my blood sugars? Well, it turns out a lot. Sleep is an area of blood sugar management that is so often overlooked, but inadequate sleep can have a huge impact on your blood sugar levels. In fact, studies show that just one night of inadequate sleep can lead to a disruption in your glucose levels. Lack of sleep causes insulin resistance, leads to an increase in stress hormones such as cortisol. Sleep deprivation can even affect your appetite and cravings, leading to poor food choices and overeating. So what is the recommended amount of sleep to prevent these issues? Well, research indicates that individuals who consistently obtain 7 to 8 hours of restful sleep each night experience the lowest A1C levels. And while achieving a restful night of sleep can sometimes be challenging, I got a few tips for you to help you achieve this. So first, make sure to avoid alcohol, large meals, and caffeine before bedtime. Make sure to engage in some form of physical activity during the day. Eliminate electronic devices from the bedroom. And a technique that has been particularly effective for me is setting an alarm on my phone that goes off at the same time each night as a reminder to begin winding down and preparing myself for bedtime. Tip number 4. Fiber. So before we dive into the benefits, I do have a cautionary note about fiber, a common misconception, but I'll share more about that in a minute. So adding more fiber to your diet, it may seem like an insignificant tool in lowering your blood sugar levels, but I assure you it is not. Fiber can have a very positive effect on your blood sugar levels. A study from the New England Journal of Medicine found that individuals following a high fiber diet had on average 10% lower blood sugar levels. So why is adding fiber so important to improving your blood sugar levels? Well, specific types of fiber called soluble fiber dissolve in water and form a gel-like substance in your GI tract. This gel-like substance slows down digestion of the foods that you're eating, leading to a more gradual release of glucose into the bloodstream, which in turn prevents sudden spikes in your blood sugar levels. In addition, this slow digestion helps you feel full longer, which can prevent overeating. So what are some tips to increase your fiber intake? Well, what I would recommend is that you start looking at nutrition labels. Good sources of fiber are those with 2.5 grams or more per serving, while those with 5 grams or more are considered excellent sources of fiber. Some easy ways to incorporate more fiber into your diet: and add veggies and legumes to soups, mix nuts and seeds into your yogurt, add spinach, broccoli, or a bag of mixed veggies to your meals, just to name a few. Now, a word of warning when it comes to fiber. A common misconception when calculating carbohydrate intake is by relying on a concept called net carbs. Net carbs are determined by subtracting all of the fiber or sugar alcohols listed on the nutrition label from the total carbohydrate count. However, assuming that all fiber and sugar alcohol is completely undigested by the body is not entirely accurate. And in reality, some fiber and sugar alcohols can be absorbed, albeit to a lesser extent. So it's crucial to exercise caution with net carbs, especially when you're using this to calculate your insulin doses. This is an area where it's best to talk to your endocrinologist or a registered dietitian for more guidance. Tip number 3, being smart with carbs. Carbohydrates are broken down into glucose during digestion, causing an increase in blood sugar levels. So it's pretty clear that limiting carbohydrate intake can help to lower your blood sugar levels. And while some diabetics have completely eliminated all carbs from their diet, this certainly is not realistic or feasible for every individual, including myself. So I have some strategies for you when it comes to carbohydrate intake, as well as sharing a really surprising and simple tip that can have a big impact on your glucose levels just by making one small change with your carb intake. Before we get to that though, let's talk about different types of carbohydrates, because not all carbs are created equal. There's good carbs and then there's bad carbs. Bad carbs, the ones you should be avoiding or having very infrequently, sometimes known as refined or highly processed carbohydrates. These carbs have added sugar, little to no fiber, and have been stripped of most vitamins and minerals. These carbs are also high in something known as glycemic index. Essentially, because of the simple sugars found in these foods, body breaks these down super fast, leading to a rapid spike in blood sugar. Some examples of these bad types of carbohydrates would be sugary drinks like soda or sweet tea, white bread, white rice, sugary cereal, and snack food like cake, candy, and chips. So those are the ones you want to try to avoid. So which carbs can you have in moderation? The carbs you should be sticking to are complex or low glycemic index carbohydrates. These types of carbohydrates contain fiber as well as other vitamins and minerals. Your body takes longer to break down these types of carbohydrates, leading to a much more gradual spike in your glucose levels. Some examples: lentils, quinoa, barley, kidney beans, berries like blueberries and blackberries. It's important to keep in mind, while these foods will have a lesser impact on your blood sugar levels, they still will have some impact. So it's best to still be mindful of portion sizes and have these types of food in moderation. Now that we have a better understanding of which carbs to consume, what about a simple tip to lower your blood sugar levels just by adjusting the order in which you eat your carbs during a meal? A study from the Cornell Medical College found that when vegetables and proteins were eaten before carbohydrates in a meal, post-meal glucose levels were decreased by as much as 37% compared to those who ate their carbs before the protein and veggies. So another way to improve your glucose levels with very minimal effort. All right, so the next tip is exercise. Let's talk about exercise next. I'm sure this one you've heard plenty of times before. Exercise can improve your blood sugar levels. But I'm not here to bore you with the details. I want to actually provide some hard evidence of just how effective exercise can be in improving your glucose levels. So for years, every night after dinner, I would always go for a walk. I never set a timer or a specific number of steps to hit. I just make sure when I finish dinner, I get up and I start walking outside. I feel better after a walk, and I assumed it had kept my blood sugar levels controlled. Little did I know just how effective it had been until I did this experiment. So 2 nights back to back, I ate the same dinner. I also made sure my blood sugar was right around the same level each night. One night after dinner, I just plopped on the couch and sat on my phone. The other night, as I usually do, I went out and I walked. And then each night after dinner, a couple hours after, I would check my blood sugar. The night I sat on the couch, my blood sugar was 158, and then the night I walked, it was 111. So this one small change, casually walking after dinner for a short period of time, caused almost a 50-point drop in my blood sugar. So if you're not currently exercising, this is something you really should try to implement. And while the American Diabetes Association recommends 150 minutes of moderate intensity exercise per week, start small. Even a short walk for a few minutes after meals can have a big impact. In fact, a recent study in the Journal of Sports Medicine found that walking even for just 2 minutes after a meal can improve glucose levels. All right, so this last tip, this is so rarely considered, it's so underutilized, yet it can be so important for improving your glucose levels. So the last tip to help you improve your blood sugar levels is by reducing stress. I know, it sounds like an impossible task, but just stay with me. I have a way to accomplish this. So stress, it can cause your blood sugar levels to skyrocket. When we're under stress, our body releases hormones such as cortisol and epinephrine, which causes an elevation in our glucose levels. So reducing stress, it may seem like a complicated task, but in reality, it only takes a few minutes each day to reduce your stress and in turn reduce your glucose levels. So how can you decrease your stress in just a few minutes each day? Well, before I share that with you, I want to provide you with some evidence first. A study from 2018 found that meditation for just a few minutes a few times per week reduced not only fasting glucose levels and A1C, but also reduced stress hormones such as cortisol. So for a few minutes each day, I want you to do nothing at all. Sit in a quiet room, focus on your breathing in and out, and simply do nothing. This quiet time focusing on breathing can decrease your stress and improve your glucose levels. And there's plenty of guided meditation apps out there on the market if you need some help getting started. All right, well, I hope this video was helpful. Thank you so much for watching and good luck with your diabetes care.